This is part 6 of the lecture for the cardiovascular system. The lymphatic system provides a system to drain the excess interstitial fluid bathing the tissues. Unlike the cardiovascular system, which is a closed system because there are tubes carrying the fluid both to and away from the tissue, the lymphatics are an open system. They only drain the tissues, so there is no pressure going into the system to push the fluid through. The lymphatics also transport the dietary lipids, particularly the large fats consumed in food, and deposits them into the bloodstream back at the heart, where the rest of the lymph joins the blood. It is also involved in the immune response with the lymphocytes. The lymphatic vessels and capillaries are more similar to veins than arteries because they have very little muscle in the walls and only perform drainage. Along the way there are lymph nodes, which are filtering stations for the lymphatic fluid before it enters into the blood. The lymphatic drainage in the body is not symmetrical. The thoracic duct drains the left arm, the legs, and most of the torso. The right lymphatic duct drains the head and the right arm. Because there is no muscle in the walls of the vessels or a pump pushing the fluid through, the lymphatics rely on the skeletal muscle pump to use muscle contraction to push fluid, and the respiratory pump using expansion of the lungs to push fluid, very similar to the way the veins operate. The primary lymphatic tissues or organs produce lymphocytes. These include the red marrow and thymus. The secondary lymphatic tissues or organs provide a place for the lymphocytes to function. These include lymph nodes, spleen, and lymphatic nodules. The thymus produces T cells, which are thymocytes. It is located on the anterior surface of the heart and degrades by adolescence when your immune system is more developed. The lymph nodes are filters located in many locations throughout the body. We typically find large numbers of them in places where you are draining an appendage. There are large numbers of them in the axillary and groin region for draining the arms and legs, around the jaw and neck area for draining the head, and then throughout the abdominal cavity. The spleen is a large filtering organ with many lymphocytes. It is similar in function and structure to the lymph nodes, only much larger. It is larger to deal with the greater amount of filtering performed in the abdomen. While you can live without the spleen, it is only removed when absolutely necessary because it is an active component of the immune system. The lymphatic nodules are essentially large lymph nodes. They are sometimes referred to as the tonsils, and we have 3 sets of them in the mouth and throat area. The pharyngeal tonsils, or adenoids, are located in the back of the throat. The palatine tonsils are located on the roof of the mouth, and the lingual tonsils below the tongue. Our immune system defenses can be categorized a couple different ways. One is innate or acquired. Innate defenses are immune strategies you are born with and are part of being human. The acquired defenses are responses you acquire with exposure. Another classification is specific or general immunity. Specific immune responses are geared towards a specific invader or particular antigen. General immune responses are not specific and will target anything foreign to the body. The first line of defense is a set of physical and chemical barriers to the external world with the goal of preventing microbes and harmful substances from entering. The epidermis or skin is a physical barrier. The mucous membranes and their secretions provide a sticky and slimy barrier to trap microbes and other particles that may enter into the body. The cilia help to move mucus and particles back out of the body in the trachea before reaching the lungs. The lacrimal apparatus produces tears and secretions to flush out the eyes, and also contains lysozyme to target bacteria. Our gastric juices are very acidic and will kill many invaders attempting to enter through the gut. Our sweat contains lysozyme to make the surface of the skin a less favorable environment and help keep microbial populations under control. The second line of defense comes into play when the microbes survive the first line of defense. One mechanism the body uses is inflammation. This is characterized by swelling, heat, altered movement, redness, and pain due to bringing chemicals into the area to control the problem. A fever will raise the body temperature to make it less favorable for bacteria and microbes. It will often slow growth enough to allow other immune cells to get a handle on the infection. Interferon is a chemical released to enhance the immune response to intracellular invaders. This chemical also makes you feel sick during the immune response. Complement is a chemical released to enhance the immune response to extracellular invaders. Unlike interferon, this does not make you feel sick. The NK cells, or natural killer cells, will attack anything foreign in the body, including cells that have turned into cancer cells. The macrophages are the scavengers of the immune system and phagocytize microbes, debris, and other immune complexes to clean up the immune response. Phagocytes are any cell that engulfs microbes and debris by phagocytosis, including the macrophages. Here we have a couple of animations on the immune system put out by Harvard Education. These links are also available for you on Angel. They do have a pop-up that will come up, so you'll have to disable the pop-up blocker to watch them on your own. And then we have a second one. Some of these are a little more complicated than what you need for this class, but sometimes the visualization can be quite helpful.